maybe they have never thought about these kind of symptoms in their life, but then they're seeing their kid, they're seeing all the symptoms that quite frankly irritate them the most because it's so similar. And then now they're seeing all of those symptoms that are so difficult for them to cope with are being addressed. They have a name, they have a treatment strategy, and so now they're like, oh wait, yeah, no, I actually have all of those things too. And I just didn't know that, number one, they went together. Number two, that there was an answer for it.
Is it that girls tend to be more inattentive and more of the understanding is that ADHD is hyperactive? Or is it that, what is it about the girl? Is it something about societal norms? Is it about their hormone, like their, pre-puberty hormones? What is it that is making these girls not get diagnosed until later in life?
Everyone's like, oh, it's quirky, or she's just different, or she's flighty, or she's flaky. And so that gets ignored as like a personality trait. What I'm seeing right now, it's especially if you're in your mid 30s or later, that's what I'm seeing. I also see a huge secondary pocket, with, again, following those hormonal changes with perimenopause. So when you're thinking about those huge hormonal shifts that happen, there's a lot of people that kind of have to now are faced with I cannot mask at this point. And then that's when they're kind of re-exploring those symptoms.
Welcome back to the show. If you are watching this, you are on our YouTube channel. And I want to thank you because we are finally at 100,000 subscribers and more, which just took a long time. And it's because of your likes, the way you subscribe, and the way you share the videos. So thank you, because the more I get to do this, the more I get to connect with amazing people on my show. And today's guest is someone that I've been wanting to have on the program for so long. She is a favorite follow of mine on social media. Her name is Dr. Sasha Hamdani, a psychiatrist, ADHD specialist, and author who has become a leading voice in making conversations about ADHD approachable, evidence-based, and relatable. You may know her from her book, Self-Care for People with ADHD, a very famous TED Talk, which I loved, or from her hugely popular videos where she breaks down ADHD myths and realities in a way that just clicks. And I wanted to bring her on the podcast because I've been noticing a growing trend, and I've lived it myself, of parents, especially mothers, realizing they may have ADHD or another form of neurodivergence after they had children. In my own case, I discovered I had a sensory processing disorder when I saw the same patterns in my son. And after my second child, those challenges became even more obvious for me. Dr. Hamdani is here to help us unpack why this is happening, what it means for parents and families, and how understanding your brain as an adult can change the way you parent and approach life. So thank you, Sasha, for joining me today. I'm so glad you're here.
Yes, thank you so much for having me. I'm so excited.
Well, I get excited when especially I watch so many videos of a creator online and then I finally get them on my show, or even better when we finally meet in person and I'm like, you are who I thought you would be.
Yeah.
That is the best thing. And I feel that already. We chit-chatted before we started recording, but I'm like, oh, this is my girlfriend. We're like friends. And every time I watch you, I mean, of course, just the way you speak and just you're also seem to be a very sensitive person like myself. Things move you deeply and I'm the same way. And I'm like, we would be besties. This is my bestie girl, and she's on my show today. So thank you.
Yeah, I love it.
So for anyone who's not familiar, tell us just a little bit more about yourself and what got you doing the work that you do.
Yeah, so start going all the way back. I was born and raised in Southern California. I was interested in medicine at a pretty young age. I got into a program in Kansas City where I could do a combined undergrad and graduate program in 6 years, which is kind of where the wheels fell off because I had left home. And that's kind of when I rediscovered, I'm saying rediscovered because I was diagnosed with ADHD as a child, but I wasn't quite let in on that conversation. So this is the first time I kind of explored and found out about ADHD in my medical school training. And, I had to recalibrate and figure out quite literally, how do you eat? How do you sleep? How do you study? How do you manage medications? All while kind of doing that whole process. And that's a part of what got me more interested in psychiatry as a field.
Yeah.
I entered my psychiatry residency. I felt like they rebuilt me from the ground up and they gave me that good training. I got so much exposure to therapy and I mean, honestly, just like kindness. It was just a wonderful experience. And then I entered private practice where I was seeing both inpatient people in the hospital and I was seeing outpatient um, people just in a office setting. And then the pandemic happened. And that's kind of when I started to branch out. And honestly, this was, after my second child, I was just very, very bored. There was nothing to do.
Yeah.
I was, at home. I really couldn't I couldn't watch any more television. Like I was done. I had completed it. So I started getting onto social media initially just to debunk some bad information out there. And as I started to get on social media more and actually explore that field more, I started to realize like how powerful it was as a tool,
Yeah.
especially during that time where we were in shutdown, to dispel good evidence-based clinical medicine, especially to underserved areas and people that wouldn't be able to seek out care. Um, and that's just continued. And here I am.
And I love what you've done. I mean, I already introduced all the things that you're doing, not only, obviously the TED Talk, which was awesome, and then the book, and obviously just being on social and all the, speaking engagements and advocacy that you do. And I love what you had mentioned. You said that obviously you had a diagnosis when you were like a child, but it was
Yeah,
never
fourth grade.
divulged to you. But then when you went through training is when you're like, oh shit, like this is
Mhm.
me. Did that light bulb moment, how did that impact you in a positive or negative way? Like having that official diagnosis as a adult of your ADHD?
So the way it kind of unfolded, so I was diagnosed in fourth grade.
Yeah.
And at that time, like it just like for especially for girls, ADHD just wasn't talked about. And so I guess that the conversation just never happened. And I was put on medication and I just kind of went through and I just assumed there were vitamins and I just didn't know.
Yeah.
This is
Yeah.
like it was just this is gonna make your brain work better, and it did.
Yes.
Like the medication itself did make my brain work better. And then when I got to medical school, that was the first time I had been without my parents. I literally within probably 15 minutes of showing up to school, I had lost my medication. So like I didn't know where it was. I don't know where my vitamins are. And so like it became a huge struggle and it became really apparent because at my first neuroanatomy test, I mean, I studied and I studied and I studied and like I went through all these extra steps to like go to Kinko's, make like I paid so much money to make color index cards of cross sections of the brain. I knew that thing inside out. I was so
Yeah.
confident. And then I took my test. I like hand in the test. I'm like way before anybody else. I was so confident. And then when the grades were posted, I got a 32%. And I was like, what the hell happened? And it's because I forgot to flip over the page. So
Oh my gosh. Yeah.
I wasn't allowed to retake the test and I wasn't. And so like it became something that I was like, I will never climb out of this hole. This is so disheartening. I don't understand what happened here. And that's when my parents were like, okay, heads up.
Yeah.
This
We
is
have to
what
tell you
it is.
something.
You
Yeah.
have ADHD. This is, and so I initially on the negative side of things, number one, I didn't really believe it. I thought it was only in boys. Number two, I felt very betrayed. I felt like I should have known that this was part of my healthcare and that it was part of my journey. And I really didn't understand at that point, especially since, I wasn't being a parent has kind of changed my lens on that. But
Yeah.
like, I just didn't understand why I didn't know about it up until that moment. So I refused to be on medication again. I refused to get help. I just was like, I'm going to prove to you that I don't have it. Spoiler alert, I do have ADHD. It
Yeah.
does not work. And then the rest of my med school training was kind of, I think my parents actually handled it very beautifully then. My dad just told me, like, you know what, don't even worry about studying for school or doing anything. Like, come home and let's just go through and try to understand your brain. And if it's ADHD, cool, we'll get information on
Yeah.
ADHD. If it's something else, cool, we'll figure out what else it is. So we went, and like for the next like 4 days, I flew home to California, and we went, I mean, it wasn't even an internet search. We went to the library and we were sitting like on the floor, going through books, going and like we were pointing out different areas of books, like, well, this sounds like me, or this sounds like me. And with him, he was like, that does not sound like me. And like, so we were both discovering parts of our brain. And I felt, number one, I felt so seen. I felt like they handled it so beautifully in that moment, because I felt like it was just like a time for them to show like, we handled it poorly. And but I mean, I can't even say that they handled it poorly, because the time was so different. Like, I think everybody was handling it like that.
Oh, absolutely. I mean, I think about in pediatrics how it was handled in the 90s and how many of those kids were, deemed class clowns or problems in school, but like, you never really put a label on it. And
Yeah.
I, and when it comes to like there's an interesting thing happens because I don't like labels for personality, like, oh, strong willed or shy. But I feel like having the label of neurodiversity to me has been helpful as a mother. Like knowing that my son had a sensory processing disorder versus that why the heck is he like this when he's melting down, when he's in a crowded, noisy place was very redeeming of like, oh, sensory processing. His brain is very filled. And that's why I was asking you, like, when you got that diagnosis, like, how did it help? Because we've been seeing like a trend of women in their 20s, 30s, especially after having children, get diagnosed, whether it's with ADHD or autism. And this happened for me. I realized I had this sensory processing disorder because I saw the same patterns in my son. Growing up, I still remember not liking to wear stockings to the point where I would hide, rip them off. It was very uncomfortable. I didn't like tags. I didn't like noise. And people would call me quirky. Oh, look at Mona. And now I'm like, oh shit. Like that makes sense because now my son is standing in front of me, hates all of these things. And this was wild to me. So I went into this rabbit hole of like looking at like, wow, there's so many people reporting that they have, ADHD, autism, sensory processing. A lot of creators on social media, especially women, were sharing their stories about getting diagnosed later in life. Some people, like critics, would say, oh, it's just trendy, like to be diagnosed. I'm like, it's not trendy. It's actually a real thing. And I want to know, like, are you seeing that same trend in your practice? And what do you think drives it? This sort of post motherhood, post fatherhood sort of realization that, wow, I might be neurodiverse myself.
So I think it's very multifaceted. So number
Hmm.
one, just circling back, times are different, man. Like in the 90s, no one was talking about this. The scope, even for physicians, was so limited. Like if you're not causing problems in the class, you weren't picked up. And the reason I was picked up in fourth grade is because I presented like a boy. I was hyperactive.
Yeah.
I was extremely disruptive. And so I just like that, and frankly not much has changed. I'm all of those things still, but it's just like it was, that's why it was picked up, and I'm grateful it was picked up, because I think it gave me a chance at continuing to do things rather than being just kind of pigeonholed as a problem and not have anything come out of that. um so the times were very different. No one was talking about it. No one knew how to pick it up. No one knew how to correctly assess it, especially for women, just because all of the emphasis, and this is like a whole secondary thing, but I think the DSM is kind of stupid in this regard,
Oh,
in that it's
yeah.
just really behind. It doesn't talk anything
Yeah.
about emotional regulation. It really prioritizes observable symptoms and instead of lived experience. And yes, there has to be some sort of emphasis on observe, but I think you also need to include that, because girls aren't going to show, for many, many reasons, a lot of these symptoms of hyperactivity or of being disruptive, or instead they're just like quietly suffering and being passed along from class to class. So that's one thing. Number two, there is such a strong hormonal variation that happens with ADHD. As your
Hmm.
hormones are changing, um, you get your ADHD symptoms worsen. And
Yeah.
so, you first start to see that around puberty. And for women, you start to see those changes happening, and everyone's like, they're hormonal, this is normal, whatever. And really, that is your body's first chance of being like, no, there's something going on here. Then you get into like your early 20s and you start to, if you haven't had already, you haven't had issues with junior high or high school and things like that, you get into college and you're by yourself. That's when a lot of other difficulty starts to unfold. But if it's not academic, maybe the loose structure of college really suits you. This is when you start seeing, relationship issues and
Yeah.
interpersonal issues and things like that. And so, everyone's like, oh, it's quirky, or she's just
Yeah.
different, or she's flighty, or she's flaky. And so that gets ignored as like a personality trait. And then once you get into this time where you're starting to have these conversations about having kids, pregnancy might go well because your estrogen is a little bit higher, but then postpartum happens and your estrogen crashes down, and it's much, much harder to mask your symptoms. And so
Mm.
that's part of the reason why sometimes you start to see it. And then your kid grows up and they are exactly like you. And so then
Yeah,
you're
that's a big
like,
one. Yeah.
and now we're entering a time where people are having, it's more part of the cultural discourse to talk about ADHD. And so it's being picked up more. And usually now your kid gets a diagnosis and you're like, but wait, this is exactly me. And now you're getting that diagnosis. So there's a lot of different reasons that things were skipped.
Ooh, I love the hormonal discussion. I know you've discussed that on your page as well, and I think that's something that people often, there's sort of like a gaslighting of like women, especially when we know that there's hormone. That, oh, she's just being, hormonal, but we know that it can impact so much. And so I really appreciate you saying that to validate a little bit of like what we're saying here. That, hey, something changed in you, and that's going to change your brain a little bit here. So
Mhm.
don't be alarmed. And I'm sure this is part of it, but parenting piles on huge executive functioning demands, right? Like schedules, multitasking, constant decision making.
Oh my
And
God.
I used to pride myself on doing a lot of those things, and I'm still very good on that. I personally don't have ADHD, but my husband does, and he struggles a lot after having kids to the point where he's now thinking of medication when he never used to. And so I'm sure you see that as well, that you add more kids to the mix or even add one and you're like, whoa, like I can't mask myself out of this anymore because there's a lot. So is there a component of like those demands or stress that makes it harder to mask or manage your ADHD symptoms that finally you're like, wow, something needs to give here?
I think it's just the consistent grind of it. Like with a
Mm,
job,
yeah.
you could still separate to some degree, but with parenting, you are in it constantly. Like you don't really have a break. Even if your kid goes to daycare or
Yeah.
goes to school, you're still thinking about it. You're still doing tasks involving, like, you're still on. You are parenting at all times. And so I think for people who are entering this parenting journey where like already executive function to get your own life in order has been difficult. Now all of a sudden you're dealing with not only your brain, but your child's brain, or maybe multiple children's brains, and schedules and planning. And they quite literally don't have a developed frontal lobe. It's not like they can help you. Now all of a sudden those needs are exponentially more. So there, yes, it is simply, there's just more to work through that gets overwhelming.
And yeah, I agree. And I see, we talked about women getting later diagnoses, and you alluded to it already that, girls won't always show symptoms. Is it that I have, I guess, a couple questions and we can take it part by part. Is it that girls tend to be more inattentive and more of the understanding is that ADHD is hyperactive? Or is it that, what is it about the girl? Is it something about societal norms? Is it about their hormone, like their, pre-puberty hormones? What is it that is making these girls not get diagnosed until later in life?
Oh, so number one, girls are more likely to present as an inattentive type. So they're the
Yeah.
daydreamers, whereas, combined type or hyperactive type, they're the people that typically are more physically and verbally impulsive, which tends to be more disruptive. So the kids
Yes.
that are daydreaming, that's not going to be a problem for the teacher. Occasionally it's a problem for the teacher, but the fire that the teacher is going to put out is the person who's getting up in the middle of class and standing on their desk. Like,
Yes.
that's what
Right.
they're going to, more often the kid who's daydreaming is a pleasure to have in class, is the kid who never causes problem and it really enjoys this year. but really they're not like absorbing much of what's going on in the classroom because they're internally distracted. Number two, this, like, just as an overarching theme, women, even at very young ages for girls, the way we are treated in society is that we're just supposed to take it. Like, so we're
Yeah.
supposed to not cause trouble and toe the line and do all of these things and not be disruptive. Um, and that's just a more global kind of thing that has happened. And I think you definitely see it more in certain cultural groups as well. So there's like an additional kind of layer of complexity that comes with that. Um, so it's all interconnected.
Yeah, I've always found it to be very fascinating because, of course, like you said, and I assumed a lot of it was the inattentive type as well. And then the, social norms of a girl to be more well behaved. And then they're just forced to mask at a very young age because of that societal expectation, like of the, you're just going to be a nice, sweet girl and polite. And I think that's what happened to me with my, I think a lot about like, again, I know we're talking about ADHD, but I'm bringing up the sensory processing disorder that is not I there's no code for it, which I have already gone through my own feelings about why I wish there would be a code so that it's more recognized. But like I think about how my parents approached it, and just to be quite frank, when I was having those meltdowns, which were largely related to being sensory overloaded, when I think back about it, my parents did a very common thing of slapping me, that
Mhm.
corporal punishment. And I learned to suppress it because I learned that if I'm acting this way, I'm going to get slapped, right? And then I grew up masking and I grew up with really bad anxiety. And interestingly, when I found out that I had SPD through learning about my son, and I had my appointment with my therapist, who's not, an ADHD specialist or a neurodiversity specialist, but I told her, and I'm like, just having this awareness that knowing that there's nothing's wrong with me, that it's a very stimulating world for me, and that I need to figure out coping skills when the world gets too stimulating, made my anxiety get better. And that's
Cool.
what, and that's when we talk about the comorbidities, I guess this other sort of nuanced question is, we know that a lot of neurodiverse individuals have other comorbidities, right? So maybe ADHD and anxiety, autism and anxiety. The anxiety piece, do we feel from a chemical level that that's existing, or do we feel that when a person can't be themselves, how of course that's going to lead to more friction and anxiety? Like, I'm wondering where that anxiety is coming from, because for me, once I got more, I'm like this and I'm going to learn how to deal with it, that got better, and I thought that was a fascinating feel for me, and I'm just curious what your thoughts are.
So it it could be both, right?
Yeah.
So
Yeah.
there is a high likelihood that if you have ADHD, you also have anxiety that's tacked along as a completely separate diagnosis. There's a high chance that you carry depression that's tacked along it completely independently. I think when you get and you boil it down, you can get a lot of answers with trying to figure out, like, are like for ADHD and anxiety, are you anxious and that's what's preventing you from focusing?
Right.
Or can you not focus and that's what's making you anxious?
Mhm.
So trying to figure out like a chicken and egg kind of thing, because, for a lot of people, the gold standard of treatment, from a medicinal standpoint, is stimulants. A stimulants is they are miserable for anxiety. They're terrible. You give an anxious person a
Right.
stimulant, they have more energy to be anxious. However, if you are treating someone with ADHD and their ADHD is causing tremendous anxiety, if you adequately treat their ADHD, their anxiety gets better. So it seems a little contradictory where it's like, well, I'm giving somebody a stimulant and expecting their anxiety to get better. But if their anxiety is truly because they quite literally can't find the faculties and the executive function to get done with what they need to get done, and they're drowning and getting overwhelmed by all of these escalating demands, then yeah, certain medications could help that in the general population might make people more anxious.
I love this. I had a patient once who they were seeing other providers, and again, diagnosed with ADHD. It was a teenager, and he kept coming to different doctors. I saw it in the chart, flying to different doctors because of just availability, lack of continuity, whatever. I saw him and we were chatting, and he's like, it's not working, the ADHD medicines. And I'm like, interesting. You've been on it for like 5 years and you've tried many different kinds. He's been on like ones that I usually feel work really well. And then finally, we had a long talk about what his symptoms were, and it's exactly what you said. He had unmanaged anxiety, and I was like, this is so fascinating. And once we got his anxiety under control, the ADHD got better. And I love that we're talking about this, because we do know that they're connected, but it can be a huge disservice if we don't get the right diagnosis or what we're treating. And like you said, it was probably making it worse. And it came up because he talked about how he mentioned how he's afraid when his parents leave the house. And I was like, interesting. Let's talk about that. You're a teenager. Like, what do you think? What's going to happen? He's like, I'm just afraid that someone's going to come and break in. And then I was like, okay. And then we went down that rabbit hole of like, bring more out for me, and I felt like a really good clinician there, because it's like you said, detective work. It's the chicken or the egg, and we figured out which one was the chicken and which one was the egg, which is not always so easy. But thank
Yeah.
you for saying that, because I hope our listeners know that, like, if things aren't working, or if a clinician's saying you have this but your neurodiverse brain maybe has another comorbidity, are we addressing the other comorbidities, or are we missing something in a diagnosis that can serve you better?
Yeah, I have a lot of people that come in and they, especially since I see so much ADHD, they're coming to me with
Yeah.
the expectation like I have ADHD. But then once we actually distill it and get down to what it actually is, it could be anxiety, it could be depression, it could be
Yeah.
thyroid illness, it could be like so many different things that it could be. So there's a lot of things that fragment focus that aren't ADHD. So I think that's important to kind of note, because everybody kind of assumes like if you can't focus, it has to be ADHD. It's not. ADHD is very distinct.
Yeah, and I think that's a huge disservice of how, again, maybe the DSM-4 criteria are clinician awareness. Especially pediatricians. Because of my own desire to understand neurodiversity better, and that includes ADHD, autism, AUDHD, like all the different sensory processing disorders. I've become like very interested, which is why I wanted you on. But many clinicians are like, "Oh, okay, you're hyper. Sounds like that." Or, "Oh, okay, you're worried about something." But you're right. Like it's doing a huge disservice, and then it's years, 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 like this child, adolescent, that was like, "Oh, snap. Like this is something different." So, thank you. And I hope people listening, if they're clinicians, understand that, pulling back a little bit, if one, things aren't working, or did we get the right diagnosis? And for all, you mentioned a few of the things that we talked about on reasons, obviously hormonal changes, finding, your child being in front of you and you're like, oh, wow, you're exactly like me, maybe. Is there a reason, like when you see adult patients that may have had children, is there one that kind of precedes the other, or you kind of see again that multifactorial approach? Or is it that many are like, hey, my son or daughter has this and now I'm realizing I do?
Um, a lot of times it's the latter.
Yeah.
I have, and it's truly because maybe they have never thought about these kind of symptoms in their life, but then they're seeing their kid, they're seeing all the symptoms that, quite frankly, irritate them the most because it's so
Yes.
similar. And then, now they're seeing all
Mhm.
of those symptoms that are so difficult for them to cope with are being addressed. They have a name, they have a treatment strategy, and so now they're like, oh, wait, yeah, no, I actually have all of those things too. And I just didn't know that number one, they went together. Number two, that there was an answer for it. And so I think it's what I'm seeing right now. It's especially if you're in your mid 30s or later, that's what I'm seeing. I also see a huge secondary pocket, like, with again following those hormonal changes with perimenopause. Like, so when you're
Yeah.
thinking about those huge hormonal shifts that happen, there's a lot of people that kind of have to now are faced with like, I cannot mask at this point, and then that's when they're kind of re-exploring those symptoms.
I love the hormone discussion. I think this is so fast. This again is why I love this show so much, is that I learned so much from that. Obviously, I didn't know the nitty-gritty behind that, and so you just taught me something fascinating and new, and I
Okay.
feel nerding out right now. So thank you, because I'm like loving this. I'm like, that makes sense. And I'm also 39, getting into that perimenopause age. And I'm like, I have no patience for this. And what you said beautifully is like the things that annoy them is then when you start to be like, wow, that's really, and then you see them do it. And then you've done that. And then I turn to my husband and I'm like, oh, snap. Like, now I know how it sounds like when it's not from me.
I know.
Or like my frustration when it's too noisy and I start screaming. I'm like, can everyone just stop talking, please? And I'm like, oh, like how come my husband doesn't care as much? He just has an ability to handle more noise than I do. All fascinating stuff. And we also see in terms of autism, right? So the in between the ages of 26 to 34, the autism diagnosis increased by 450% between 2011 and 2022. I
Yeah.
don't think we have the same stats for ADHD, but correct me if I'm wrong. But do you see, I mean, you've been practicing, do you see this sort of significant increase as well, like in ADHD
Yeah, I do.
diagnosis?
But
Yeah.
I also think that that was due to a couple of things. Number one, I think honestly, I think the shutdown really, 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 really amplified that because now we were all kind of all of those structures that people previously had built to kind of keep their lives in order were taken
Yeah.
away. We're now forced to kind of be at home with like very loosey goosey structure. Things were changing every day. Everybody is like, the only way they have any sort of social connection was they were on their phones. And that's when people started sharing symptoms. And it became something that people were a lot more open about talking about and discovering together. And I think the diagnostic rate really kind of shot up at that time. Um, but I don't necessarily think it's because there's more people with ADHD. I think there's always been that same number of people with
Yeah.
ADHD. It's just we're picking it up more.
Yeah, like comparing to our childhood, right? We've had press conferences, as you know, for like autism and, things like that. I know you've been well aware, talking about how this is an epidemic and this is a problem. And I'm like, from our side, I mean, you agree that it is absolutely awareness, better diagnostic criteria, people also having less stigma about coming forward with these things, right? Because, like you said, when you're going online and you see your favorite creator share their story about how, wow, like I got my diagnosis of autism or ADHD, it brings up curiosity in yourself. And I think, like I said, this ownership can really change, how you approach. Like for you and the patients you've worked with, and also for yourself. I know you had that diagnosis when you were in schooling. When adults finally get a diagnosis, it can completely shift how they view themselves, and I think also how they parent. So, how have you seen that self understanding about one's own neurodiversity change the way moms and dads may approach their kids or their own lives?
I think that it's an interesting phenomenon because I think a lot of it starts with once you understand your own patterns and your own brain, it gives you just a lot of grace with yourself, which is
Yes.
something I feel like parents don't have enough of. Like I myself, going through this parenting journey, I am constantly thinking about if what I did was wrong. I am
Yeah.
constantly kind of going through and triple checking with other people, like what would you have done, how is this different. I'm getting little pieces of information. um I shouldn't have yelled so much. I shouldn't have had such a big robust response. I shouldn't have shown them so much emotion, like if I was going through something heavy. Like those are things that you think about, but then when you are able to kind of put this in the context of like, I am showing them that this is how my brain processes things. And as long as you're doing it kind of in a healthy way and you're showing them and explaining them and giving them the vocabulary, I think that's actually wonderful. I mean, it's going to give them
Yeah.
a wide berth of kind of this is the full spectrum of what a brain looks like. This is what mom is like, this is what dad is like. And you show them how to handle those kind of emotional ups and downs. I think that's one of the best things you get from a diagnosis. The other thing is, I think it also gives you, especially if your child is going through something similar, it gives you an opportunity for a very close bonding in that as you guys are both kind of discovering and just knowing your parent has something immediately destigmatizes it immediately.
Yeah.
You're like,
Yeah.
this is something that, my mom has too. And my mom is the closest person in my life. And, you immediately shift how that person, whereas, I feel like had I known that, everybody in my family operates in a very different brain spectrum. So, knowing my
Yeah.
mom doesn't have it, my mom might, but not when that.
Same. I was just gonna say, I was like, I now that I become down this information rabbit hole, I'm like, I think my mom has inattentive ADHD. It makes sense. I used to get mad at her when she would not listen to me, but it was totally inattentive ADHD. But anyways, side note.
Yeah.
Yeah.
But I feel like I think that if I had known about ADHD, and especially since it wasn't being talked about, I would have felt kind of isolated in that way. And I would have felt othered kind of, which is
Yeah.
hard because I already felt othered because I was the only brown kid in my school. I was, it was a weird way to kind of grow up. And I think my parents were very, very conscious of that. And they didn't want yet another thing to make me feel different.
Yeah.
But I think what now we're seeing a shift towards is, that difference in how your brain is wired. It's not necessarily good or bad, or because it comes with, while you deal with some of those deficits, it does come with positives as well. So you can kind of
Yeah.
see. I'm never, ever, ever in a million years going to be that person who says it's a superpower, because I think that's dumb. I hate it so
Hmm.
much. And I think it really minimizes people that do struggle. But I
Yeah.
do think that there are positives. And I look back at my own life, and like even starting social media or writing a book or doing a lot of the success I've had is directly related to my ADHD. I wouldn't have like taken that leap or hyper focused to get something done. It is because of my ADHD. That is what that difference was. So, um, and now I don't remember what the question was. What?
Oh no, you answered it. I was asking about like how this can change of the when you have that diagnosis, how can it change how you parent? How can it change how you have self-understanding for yourself? And you just answer that beautifully. And I love, you talked about the connection with the child, and we know that a lot of this is genetic. And so when you see it in your child, when you're also going through that in your brain, it's a phenomenal way to connect. And I've done other episodes for anyone listening on if you are a parent of a neurodiverse child, but you yourself don't have that. Like it's a one that I did with the Childhood Collective about ADHD. Like if you yourself don't have ADHD but have an ADHD child, how to approach. But no, you're right. I mean, even with Ryan, like he has a auditory his sensory is very much auditory, like
Yeah.
meaning it's noises and it's also a little bit of light too. And once I started to understand this and knew the triggers and telling his brain like, hey, we're going to go to Gerba. So Gerba is like a very, it's a traditional event. It's very loud and it's an enclosed space. There's drums. There's a lot of things. It's not going to be very ideal for him. And then when that happens, he meltdowns faster because his
Yeah.
brain's overloaded. So we bought him headphones. And this is the first time that I bought the headphones. And I asked him before I bought them, I'm like, hey, you know how sometimes when it's very noisy, your brain feels like it's moving really fast? And he's like, oh, mommy, yeah. And I'm like, do you think you would want headphones? And he's like, oh, these are really cool. I got it. And now he's so excited about it. I'm like, whenever you're feeling like you need to be a little more quiet, we're going to put those on and mommy will have them on her and we'll put them on and it's going to help you. And just being able to empower him like makes me feel like I can connect with him better versus what was happening before is my husband and I both getting frustrated with him. Like, come on, Ryan, why are you melting down? Vera in our head, Vera's not melting down and she's two. Well, Vera doesn't have a sensory processing disorder and her cup can handle a lot more. And so to your point, I think just having the diagnosis and the label is not this sort of like, well, he has SPD. We're just going to do whatever the heck we want. It's he has SPD. And now I want to figure out how can he process this world where he's not self-combusting and that he's not feeling like no one understands me and that when he gets overstimulated that he knows what he can do to cope. And that's what I think this is about, right? I think sometimes when people hear, well, oh, they got the diagnosis, that's just a cop out. I'm like, I disagree. I think we're dealing with these beautiful children that, like you said, I don't say it's a superpower because it's come with a lot of struggles parenting a neurodiverse sensory processing child, but it comes with this sort of if I know it, what are the super tools that I can use to help him? Like, what are those tools that will make it that this is special? This is his superpower for his SPD that he can use that says, okay, now when things are overwhelming, I can put on my headphones or I can go to mommy and we can leave the room, you know? And that is looking into self. And that's why I think this conversation is so important.
Yeah, I would agree. I think that having a diagnosis and actually critically looking at how your brain works, it gives you this incredible opportunity to build like a specialized toolkit. And I
Yeah.
think that giving your kids that ability to create that toolkit for themselves and know how to use it, that not only is going to equip them and give them resilience as they're going through, but it gives them a tremendous amount of agency in moments where, like, you know, they might feel like this is hopeless, I'm overwhelmed, this isn't going to get better, everyone's mad at me, like it's just a lot
Yeah.
happening at once.
Yeah. And I know you've spoken about like, I think I'm getting the term wrong, like rejection. What's the term of when like when you get
Rejection
rejected?
sensitive dysphoria.
Yes. Okay. And I remember I learned that term from you and I was like, wow. And I love learning terms from you and again just how feelings are and again in your content the way you position it and the way you talk about it and how it can tie into how you feel, how you view the world and how it's not just you being this overly sensitive person, it's that this is a thing. And how am I now going to manage that? And you've shared that story so beautifully. You know, I love that you are vulnerable and sharing how you approach the world having ADHD because I think it helps so many of your followers feel so connected. Whether they have ADHD or not, I'm looking at it as someone who doesn't have ADHD and I'm like, wow, I love this. I love learning because it's going to help me with my patients. It's going to help me with
Yeah.
my husband who has ADHD. And it's also going to help me with any sort of neurodiversity, respecting the differences of people's brains. Thank you so much for going through, you know, the not good or bad. Obviously, the terminology that you mentioned that it's not a superpower. I really appreciate that. Are there any other things that you would love to destigmatize about ADHD or neurodiversity? Maybe the way people frame it, how it's talked about online, or even by professionals?
So here's my honest take on this. I talked about this a little bit earlier. The DSM is narrow. I mean,
Hmm.
it's dumb. It should be. It needs to be redone. We're behind in the U.S. I mean, the diagnostic criteria was updated in 2019 in Europe, and they included emotional regulation. I think that is a very key part of ADHD. And if you look at it, and if you're a clinician, if you are a parent, if you are someone who
Yeah.
has ADHD, you know that the emotional regulation side of things, it can be so difficult to manage. I mean, and you see that with all sorts of things with um, just neurodiversity in general. It's not just this talking about that internal experience of the emotional regulation, of emotional sensitivity, of difficulty kind of reading social cues and making the right response when you're dealing with impulsivity or when you're dealing with quite literally not processing those cues appropriately. I think it's important that we add that, and that is a hill I am willing to die on. And that's actually what my next book is coming out in October of next year.
Nice.
And it is about just the neuroscience of emotional sensitivity and emotional
Mm.
dysregulation. And like my hope and dream is that it is used to, number one, help just the general population kind of understand that component, because it's never talked about and because it's not
Yeah.
part of the diagnostic criteria, it's not studied, it's not researched. So my dream is to have enough momentum behind that that we can start
Yeah.
to incorporate that into diagnostic things, because there's no reason it should not be.
Oh, I love this. And I felt the same way. You know, a lot of the screening tools that are being used, not only for ADHD, but for autism as well. You know, I even, when parents are handed the MCHAT, I'm like, okay, this thing is like, I mean, is it a good starting point? Yes, but it's not thorough enough. We need
No.
good conversation. We need better screening. And it's better than what it used to be. But the DSM criteria for many things, obviously for autism included, even when they did their revamp, a lot of pediatricians didn't even get the memo. And so like people were still in outdated, you know, diagnostic criteria. And
Yeah.
so it's scary and concerning to me because as general pediatricians, we are the first line for a lot of these families' concerns. You know, they come to us for the ADHD, for autism, for the screening, for any sort of neurodiversity. And I believe there needs to be better neurodiversity training for pediatricians. I think we
For
don't learn.
everybody.
Yeah, I mean, absolutely. And obviously, like when we see when we see how people portray it or the misinformation around it, but having more understanding. And I think you did a really great job in this episode of like just again going back to how do we approach the world? Here's what it is. Here's why it happens that maybe an adult woman may end up getting diagnosed later, and that it's not something that's being faked. It's real. It's out there, and the more we understand it, the better we can serve all of our neurodiverse community. And I really appreciate you today coming on and chatting with me about this topic that I went down a deep hole on like, why? Tell me more. So thanks for entertaining my curiosity. I really appreciate
Always.
it. Yeah. And where can everyone go to stay connected with you? Obviously, you have your book coming out next year in 2026. You'll have to come on again if you're willing to chat about that, because I would love to dig deeper into that area that obviously is underserved right now in terms of
Yeah.
education information. But yeah, where can people go to stay connected for all the amazing resources you have?
So, my handles all across social media are the Psych Doctor MD. So that's on Instagram and TikTok and YouTube. I also have for my parents of neurodivergent children or if they're neurodivergent themselves. I have worked on creating an app called Focus Genie, and that it was
Hmm.
released in 2023. And I feel like that is one of my favorite resources just for like burnt out parents
Love
because
it. Love
that
it.
is great for like anybody with ADHD because I think I've worked so hard to create just little educational modules so that you can truly understand ADHD. We've worked on gamifying a to-do list so you can go through a to-do list. And if you feel like you are just tapped out or burnt out, I mean, there is AI task breakdown. So you can have this app just
I
tell
love
you what
that.
to do, which I think
I
is so
love it.
wonderful. There's timers where you can do it. And I actually, with my kids, I, is especially if we're doing things like transitioning between tasks, like sometimes what I'll do is I'll be like, okay, well, let's do this timer and we'll do it together. But it's got like ADHD boosting audio. You can body double there. It's like everything that I needed to make my brain work throughout the shutdown that is available on that app. And that's on Google Play and it's on the App Store. And then specifically, the other resource I use for parents that I really love, and it's on my Instagram page, and I'll give you the link to that. Is I created a 30-day um, e-guide just for
Nice.
parents to get started and understand their brains. And this goes in terms of like, how do I explain ADHD to my child? What is actually happening in my brain? What do I tell? How do I approach this with the teacher? So like understanding, I thought there was a huge gap in knowledge like what's an IEP plan? What's a 504 plan? What is
Nice.
all of this? So this at like having all of this stuff, including links all being in the same page, I felt like this was just such a nice resource in terms of like getting information out that is all consolidated in one spot of like how to deal with your child's brain and how to deal with your brain all in one spot.
Mm. Love that. Oh, I can't. I'm going to attach all of that information. I'm also probably going to get the e-guide because I just want to learn. Like I said, I'm a huge nerd, and neurodiversity is something that I just on my own desire want to learn more. Like I said, I think just more clinicians and the community needs to know. Sasha, thank you so much for joining me today. This was amazing. Everyone listening, I'm going to attach all of those links. The first order of business is please make sure you share this episode if you found it helpful. I loved being able to chat with her today. The second order of business is you got to go follow her and check out her resources, which I attached to the show notes today. And thank you for tuning in. This is how we continue to get the most amazing guests on the show. And I cannot wait to chat with another guest next time on the PedsDocTalk podcast. Thank you so much.